So this day very much is themed on elderly cats, which definitely are a passion of mine. And I think the first question to ask is, well, when is a cat old? And certainly it's been a frustration to me that if you go into like a supermarket or a pet store and look at their senior foods aimed at the older individual, often it's from 8+, and you think to yourself, or I think to myself, well, if a cat lives to be 20, which many cats do, how can it be a senior for like more than half of its life? That doesn't really seem to make logical sense to me. International Cat Care a few years ago came up with this chart, which I think is a useful one to consider in terms of the different life stages of cats, and also really helpfully, I think, a human equivalent age. So what you can see here is the different life stages from kitten through to geriatric, and then in the left-hand column the age of the cat that corresponds to these life stages, and in the right-hand column a human equivalent age. And I think this is really useful for our clients, because if it comes to us wanting to perhaps see an older cat a little bit more frequently, or perhaps do a bit more of a detailed examination, if our clients are saying to us, well, why? Justify this to me. I think it could be quite helpful to really make that comparative analogy. So for example, the 11-year-old cat is equivalent to a 60-year-old person. I know, or I have been told, I live in Scotland, but I have been told that in England, when you're 60, there's no one of that age in this room, but one of the things that happens is you get a letter from the NHS inviting you to send them a sample of your faeces for occult blood testing for colonic cancer screening. In Scotland, it's actually 50. So we've experienced that in our household. I'm not quite there myself, but my husband has been invited. And therefore, if you're seeing particularly older clients who've had these age-related triggers themselves in their own healthcare, it resonates with them. So if you've got, your retired client, they've had that invitation, they've been told perhaps, it's time for a prostate screening or breast screening or cervical cancer screening, whatever it is, they will have experienced it. And some of these things are triggered at certain ages. Therefore, if you can say, well, your cat now is equivalent to a 60-year-old person, it's not unreasonable for us to expect that perhaps they have different needs, and we need to see your cat a bit more frequently. So that's very much a focus for today, and as you'll all know, there are a lot of older cats in the UK. We don't really know exactly how many senior and geriatric cats that there are in the UK, but certainly millions of them, and many of our cats are now living to a greater age. And of course, if you've had your cat for, let's say, 15 years or longer, that's a big chunk of your life and your ups and downs. Perhaps since you acquired your cat, you've got a degree, you've got a job, you've got a house, you've got married, you've had children. The cat may have been through all of these changes in your life with you. So they are really very important in many households. I think often the relationship between a carer and their older cat is understandably quite protective because they've had this long-standing relationship, and perhaps certainly from my experience, the relationship can be not dissimilar to a parent and a very small vulnerable child, because again, cats, everyone knows, they don't like going to the vets, they feel quite threatened by changes in routine, so they are quite special, quite fragile individuals. We do have a little bit of data from SAVSnet, the sort of health screening programme that's run through the University of Liverpool, to show us that there are more and more older cats coming into clinics. So this is just a chart of the ages of dog, cats and rabbits coming into the clinic, and you can see there are a fair number of cats in that right hand side over the age of 14. So there's certainly, we know that cats do appear to be living longer and coming into the clinics, but a lot of older cats, a lot of cats in general, as you'll know, just actually don't come into the clinic that often. There's still often this perception that cats are fine, they don't really need vets, you only take them to the vets if you're worried about them. So we do have a big challenge of really trying to sort of maintain that contact, trying to see them, and make sure that we identify these older cat health issues, because a lot of the time there are the various barriers really for owners